Assalamu alaikum, and a very warm welcome to all our viewers on this, the very first show of Natural Health on Deen TV with me, Dr. Fatima Paruk. We do hope you will join us every week so that we're able to familiarize you, our viewers, with the expanding world of alternative and preventative health by introducing you to a diversity of different therapies and practitioners, as well as a variety of health-related topics from a natural health point of view. We look forward to bringing you up-to-date and interesting health-related shows to enable you to make informed choices about your health, as well as keep you abreast about the many different natural health therapies that are currently available here in South Africa, their benefits, and how they can be used effectively in treating common health problems. Today we have with us a very special guest in our studio, Professor Ashley Ross, who is an Associate Professor at the Durban University of Technology, as well as the Deputy Dean of the Faculty of Health. He is also the Vice Chairperson of the Allied Health Professionals Council of South Africa and represents the Department of Homeopathy there. Welcome, Professor Ross, and thank you for joining us today.
Thank you, Fatima. It's a pleasure.
Can you tell us a little about yourself and what led you into the field of natural health?
Okay, it's quite a long story. It's a long time ago. I've been involved in natural health now for 25 years, firstly as a student and then subsequently as an academic and practitioner. I first ran into natural healing while I was studying music. So I started off with a music degree, and somewhere in the middle of that degree I developed a problem that needed attention, and I took it off to a number of practitioners, and no one seemed to be able to solve the problem. And eventually, in desperation, someone suggested I consult a homeopath. And I did that, and literally within days, my problem was solved. And that got me thinking about specifically homeopathy, but also the much broader perspective of natural healing. And about a year and a half later, I decided I simply had to study homeopathy, and that's when life changed.
And you're now here in Durban in private practice as a homeopathic practitioner?
I am in practice. Obviously, I have to juggle somewhat. So for a period, I was the head of the Department of Homeopathy at DUT. So I've always had this mixture of practice, teaching, and academic administration.
So tell us, in your opinion, how do people view natural health in comparison to mainstream medicine?
I think it's changed over the years. Natural health, I think, is gaining a certain amount of ground and credibility. But certainly when I was interested to study homeopathy, natural healing was seen as something that lacked a certain amount of scientific credibility. It was a bit of, coming from Cape Town, I was called a bossy doctor. The idea that it's sort of granny's suggestions not backed up by science, and a useful form of medicine to be used in things that would go away on their own.
And tell me, in your opinion, what would you say is the fundamental difference between natural health practices and mainstream medical practices?
It's quite a complex question, that, but I think for me, most fundamentally, what is different is that within mainstream medical practice, there is a fairly linear view of health of human beings. There's an understanding of disease as something which is wrong, which needs to be corrected. And usually that would be either, in some cases, surgery or by medicine which will prevent the particular symptom from arising. And fundamentally, in most natural medical systems, there is a recognition that we are ultimately capable of healing ourselves, and that the emphasis is really on the maintenance of health rather than the treatment of disease. And when disease does manifest, that disease is seen as a distortion or something which the body needs to be assisted in regulating by itself, rather than something which is done to a patient to control their symptoms.
So maintaining your health throughout the process, as opposed to just fixing problems when and if they occur.
Yeah, absolutely. The emphasis in natural healing is to have me live in the best possible state that I am able to live, rather than to just control symptoms. And the pattern there is that if your natural healer is doing their job properly, you should not really be taking any medicines, and you should be able to live a comfortable and productive life.
When you say any medicines, you mean any medicines at all, or?
Well, I think any medicines at all, in an ultimate sense. But what we see in the more conventional approach to medicine is that as individuals age, they find themselves taking more and more medicines. And typically when I present with a problem in my 20s and I take some medication for that, there is a certain expectation that in the long term I will be taking that probably indefinitely. So if I'm diagnosed with having hypertension, high blood pressure in my 30s, there is an understanding that I will need to take medication for the rest of my life. If I'm diagnosed as an asthmatic, I will have to take medication for my asthma for the rest of my life. And from a natural healing perspective, that's not really a cure. And the objective in the bigger scheme of things would be to get me to the point where hypertension or asthma is no longer a necessary component of my living.
And that comes through in natural therapies and natural forms of practicing medicine, where you could actually build up a person to the point where they would not need that medication anymore. Am I correct in saying that?
Absolutely. Obviously, there's a fair grey area where individuals, because of degenerative changes or other factors that prevent complete reversibility of that disease condition, you might need some sort of compromise. But certainly if we get in fairly early in the development of a disease process, most conditions are to greater or lesser extent reversible, and I think that's a much better option than to resign oneself, in a sense, to controlling symptoms and not actually being able to get to a point where you don't need to be treating that on an ongoing basis.
So not ongoing medication for a person. Treat it when and if it happens, and try and reverse it as much as you can.
Yeah, I think that's true for most natural medical therapies.
Practically, is it applicable?
I think it's quite achievable in many cases, and certainly having been in practice for 20 years, I've seen many cases where theoretically those conditions are conditions that are to be expected to occur and need to be treated for the rest of an individual's life, where those conditions have been reversed.
And time frame. I know people are very niggly about alternate therapies and the time it takes for this to happen. Can you enlighten us a little?
There is that perception. There is that perception that orthodox medicine produces rapid results, and that natural systems of healing are necessarily slow and, relatively speaking, less effective, ineffective. And I have an interesting perspective on that, because what orthodox medicine is really spectacular at is the management of symptoms. So if I have osteoarthritis of the knee, and my knee is really very sore, and it's making it difficult for me to walk, if I take an anti-inflammatory, I can literally have a knee I can walk on in minutes. The problem is that the degenerative change of the osteoarthritis of the knee is just going to continue. And so I have symptomatic relief, but there is no fundamental change to the progress of that disease. 20 years later, I will decide I need to see the homeopath or the naturopath or the acupuncturist for the treatment of my painful knee. And then I'll be frustrated because I don't have relief within an hour or two. But over a period of, if I were to see that practitioner earlier on in the progression of the disease, it might take 6 months to have me pain-free. But the destruction of the joint, which is the inevitable consequence of that disease, may not occur. So if I'm going to spend 6 months getting to a point where I am absolutely pain-free because the condition effectively is reversed, is that shorter or longer than getting instant relief and battling with that disease for the next 20 years?
So taking a superficial view is not always the answer. Sometimes you might as well, bite the bullet and take that time and get it sorted out properly so that you're not living with this health condition and sitting with something that probably can't be treated very later on in your life.
Yeah, I think this is a very important perspective which natural healing has, and that is essentially it arises out of the view of the human being as an integrated totality. So no symptom is seen in isolation. And so what we have in our current predominant view of health and disease is, for argument's sake, if I had eczema, that's seen as a skin condition. And if I cure that skin condition or I get rid of that eczema, and 6 months later I develop asthma, that's seen as a completely different condition. And if by some mechanism I eventually found myself not suffering with asthma, but I developed some degenerative joint disease, that would be seen as a different disease condition, and each of those disease conditions would be treated by a different specialist. When we look at the individual as a whole, we can see that in fact there's been a degeneration that has occurred in that individual as we've gone through that path. No one ever dies of eczema. The suffering that is associating with having degenerative joint disease, or the risk associated with having asthma, is considerably more than that eczema ever was. So if we look at the much bigger perspective, the objective is really optimal health. The objective is not just control of symptoms.
And look at the body as a whole instead of just different sections. It does all work together on some level.
Absolutely, the body has to be viewed as a whole, and in fact it's broader than that. We have to look at the individual as part of a much bigger ecosystemic entity. We've got to see this individual not just as a head and chest and legs. We've got to see this as a mother, a father, a child, an employee, an individual who lives in a particular environment, who eats particular food. We've got to look at this individual in a very holistic way, and to understand all the various factors that might be impacting. And those aren't always necessarily physical factors. All the factors that are impacting on this individual's ability to maintain optimal health in the face of various things happening in various areas of the life.
So is this a common thread that runs through all the different types of natural health practices, would you say, in your opinion? Or is there a specific, another common thread that might be identified?
I think if I were to reflect on all the natural health therapies that I'm aware of, there are a number of words that come to mind. One of them is holism, the idea of looking at an individual as a whole, of trying to link variables and factors that aren't necessarily usually linked. Another concept which always comes into natural healing is the concept of balance, of the individual being dynamic and of trying to find a point of balance, that in fact swinging too much to the left or to the right is problematic, and it's about restoring order and balance. And I think the other component, which is intrinsic, is the idea of self-healing, the idea of trying to stimulate the individual to heal themselves, so that the ground that is gained, in a sense, if I present with a particular disease condition and I improve, that ground is in fact ground that has been gained by the individual, and so it's less likely to be lost. Whereas the more orthodox view, there is very often a tremendous amount of ground which is gained, but that ground is not necessarily gained by the individual moving to a greater state of health, but it's gained because we are able to artificially hold that disease in check. And as soon as we withdraw the medicine that is holding that in check, we very often see just how diseased that individual is or has become, because very often there's an escalation over time.
The very simple concept of get off all your medications and see where your body is at.
Yeah, sometimes that's risky though.
Very risky for a lot of chronic conditions, I would say, and some acutes as well. In terms of the Allied Health Professions Council, what is it very briefly, and what does it stand for?
Okay, the Allied Health Professions Council, for viewers, the easiest comparison would be to see it as the alternative, complementary and alternative medicine version of the Health Professions Council. In South Africa, we have a number of statutory health councils that regulate various professions. The Health Professions Council regulates the affairs of most of our more conventional medical practitioners, including people like physiotherapists and psychologists. The Allied Health Professions Council is a statutory health council of the same status in law, and their task is to regulate the complementary and alternative medical realm. And as such, there are 4 professional boards. There are 11 professions regulated by the Allied Health Professions Council. There is a professional board which regulates chiropractors and osteopaths. Those are the manipulative disciplines. There is another which regulates the more Western medicinal therapies. So those include naturopathy, homeopathy, and phytotherapy, which is Western herbal medicine. There is a third which relates to the more Eastern medicinal therapies. And so that includes Chinese medicine and acupuncture, Ayurvedic medicine, and Unani Tib medicine. And then the 4th professional board relates to therapeutic aromatherapy, massage therapy, and reflexology. So those are the 11 professions.
So those are all our allied health professions in South Africa at the moment.
Those are the allied health professions, and what it means to have the Allied Health Professions Council is that individuals who are practicing these professions have to be registered with the Allied Health Professions Council. So for viewers, if you're wanting to know whether the naturopath you're going to see, the homeopath, the chiropractor that you're going to see, whether they have had an appropriate training and whether they have a legal right to practice that particular form of natural medicine in South Africa, you need to be able to see that they have a registration with the Allied Health Professions Council.
Okay, that's great. Having been in the industry for over 20 years, what are your views on the future of natural medicine, locally especially, as well as globally?
Locally, I think natural medicine, South African trained practitioners of complementary and alternative medicine are amongst the best trained in the world, and I think that really is great for South Africa. The training of homeopaths in South Africa is exceptional, training of chiropractors similarly, and we also have at universities outside of Durban, we have training in Chinese medicine and acupuncture, Unani Tib, Western herbal medicine, and naturopathy. And currently we don't have training in osteopathy and in Ayurveda in South Africa. So all of those practitioners are essentially individuals who have trained internationally and come back to South Africa. We really do have well-trained practitioners of natural medicine, and what is beautiful actually in the training of many of these professionals in a South African context is that they go through quite a considerable training in traditional medical subjects, and in fact they do study traditional pharmacology and they do normal medical diagnostics. So the practitioners of alternative medicine in South Africa are really quite medically responsible and medically literate, and they are able to refer their patients to other healthcare professionals, whether they be orthodox or not, so that we can ensure that the patient actually gets the best treatment that is possible.
Okay, that's great. Lastly, if you would just indulge me a little further, what is your definition of natural health?
It's a tricky one. Natural health it's a system of medical therapies which seek to assist the self-regulating mechanism of the body to heal itself using a range of natural therapies, from using literally forces available in nature. So for instance, within naturopathy we might use water, we might use solar energy, we might use nutrition, going all the way through to somewhat more esoteric systems like acupuncture, traditional Chinese medicine, and then homeopathy as well.
Thank you, Professor Ross, for joining us here today on Natural Health. We do hope to see you again in the near future.
That would be a pleasure. Thank you.
That's it from us today on Natural Health. Remember to get your natural health questions answered by sending us an email to the address that appears on the screen. We do look forward to hearing from you. Join us next week when we explore the multidimensional model of health and how it applies to natural health therapies. We'll see you then. Assalamu alaikum.